Hey folks, welcome to the weekly brown bag for Friday, August 27th. I will be reviewing the week, basically the week's worth of COVID numbers and news, both locally as well as globally. As usual, this is obviously on Zoom, and if you want the link to the Zoom feed, please direct message me. I'll try to get that to you. Otherwise, this is also on Facebook Live, so you can watch it later. And I will upload the recorded version of this to my YouTube page later this afternoon. So if you can't watch it right now, you can watch it later. So if you have any questions, please throw it up on the chat in the Zoom feed, or put it up under comments in the Facebook Live, and I'll try to get to them. Okay, so let's get started. I have a lot to cover. Today, I want to kind of not change things up, but kind of minimize the time spent on the numbers because they're not really changing much. So I'll try to cover some of the more significant changes as far as the numbers, and try to spend more time on the news because I have a lot of content, news, and studies to review. Today, I really want to review the evidence around breakthrough cases and transmission among breakthrough cases, and the implications of that to the pandemic as a whole, and how this all goes away. Preview, it doesn't go away. I also want to cover some of there's some really interesting polling around vaccine hesitancy. And given the news this week that the FDA has fully approved the Pfizer vaccine, it's called I don't even know. It's a goofy name that they named it. I'll just continue to call it the Pfizer vaccine, which I'm sure will anger many Pfizer marketing folks, but they should have not picked a stupid name. Anyways, I want to talk about some of the polling data around hesitancy, given a lot of people are wondering, will full approval of by the FDA change some folks' minds? So I want to kind of go over some of the polling data and look at some of the trends around hesitancy and see where we're at. So I want to cover those two topics. But first, let's cover Let's cover the numbers really briefly. So globally, we have not matched the peaks that we saw earlier on this year, either during the holiday period or the more recent peak right around May. Of course, that recent peak was driven by India numbers. So we haven't quite met those numbers, and looks like some good news. It looks like numbers are starting to plateau. We'll see where that goes. We've seen plateaus before. So let's see if it actually starts to go down or plateaus or it continues to go up. With Delta, it just makes things really, really unpredictable. So we're about 650, 660 cases per day. Little slight increase in the last 14 days, but not much. So that's good news. It's single-digit increase in the last 2 weeks. Deaths are hovering around 10,000. So again, those numbers, of course, are going to be grossly underestimated. Deaths even more so than cases. The hotspots right now, well, we are one of the hotspots in the US, definitely one of the hotspots. The UK remains a hotspot. Iran, Mongolia, Malaysia, Botswana, Cuba, and a lot of Western Europe are currently going through a significant surge. So in details, you can see the number of new cases. These are case counts. You see the US is now leading the world by a fairly significant margin. If you look at this number, you can see that North American numbers are growing. Asian numbers, some good news, it is starting to go down a little bit. We'll see if that continues. Asian numbers have teased us before going up. Asia is a massive continent, of course, and hotspots keep popping up all over Asia. Last few weeks, it's been Malaysia, Indonesia, and Southeast Asia. Right now, Iranian numbers are starting to go up. Same with Turkish numbers and some areas of Central Asia. So we'll see what happens with Asia. course, North America, that's largely driven by the US, but Canadian numbers are starting to go up as well. I know the Ontario provincial government is very concerned about numbers, and their hospitals are starting to fill up. Europe numbers are kind of at a weird plateau. Seems like the numbers are starting to shift east. So we're seeing increasing numbers in Germany, parts of Central Europe like Switzerland, and Eastern Europe starting to feel the Delta surge. South American numbers continue to do well. They're continuing to go down, which is really, really good news for a continent that suffered so long. African numbers, again, it's hard to read into African numbers just because they're so, probably a huge underestimate, but so far so good. It looks like there has been some surges, Namibia, Botswana, in the southern part of the continent, but it doesn't seem to be as bad as we thought. We'll have to keep an eye on it. And then Australia, New Zealand, that area, there's actually is a significant surge in Sydney, but it's not showing just because the population is so low. So if you look at individual countries, you can see that we lead the world by a significant margin in terms of new cases a day. So we're at about 152 cases a day. So not good at all. So you can see how significant our lead is. Iran is second. India continues to struggle. Even though they've went past their peak, they're still continuing to struggle with Delta. So they haven't fully recovered. They recovered from their peak, but they're still struggling with Delta cases in the subcontinent. Then the UK, Brazil, Japan. I'm really shocked that Japan has gotten so high. We're talking about sixth in the world. We're talking about a country that has up to this point done extraordinarily well controlling the pandemic. I'll say it again. Olympics were a bad idea. And now the Japanese people are going to suffer from it. Remember, Japan also has the oldest population in the world. Healthy, but still older, and a high risk for complications and death from COVID. And you can see the rest of the list here. So really dominate. It's kind of, there's no one region that's dominating the numbers. You can see you got Asia, you got North America, you have Europe. Brazil continues to struggle, even though they're doing better than before, but that's a fairly low bar. They're still struggling. I mean, it's better, but it's not great. You got Southeast Asia, you got, Africa, you have a wide variety of countries. It isn't one region. For a long time, it was just South America, but now it's just kind of scattered all over the world. From a per capita standpoint, we're looking at Botswana, Georgia still struggling. So there are regions in Central Asia that are really, really struggling, particularly in the Caucasus region. Mongolia is flaring up again, Malaysia as well, and Southeast Asia continues to struggle. Again, it's really frustrating to see that because up to this point, they've done such an amazing job controlling numbers, and you can only do so much without vaccinations. You really can't. Japan as well, really, really tough seeing Japanese numbers go up as high as they have been. So from a per capita standpoint, we are by far the highest. So more than 300 cases per million people per day. That's extraordinarily high. And that it's continuing to go up. We'll see if it starts to peak. There are some signs nationally that perhaps some of these states that are really struggling with numbers are starting to peak. We'll see. Europe numbers, you're seeing that slight increase. UK numbers are kind of going back up after that decline. But really, it's starting to shift towards Central Europe as well and Eastern Europe. So South America continues to do much better. They're now below Europe and North America. If you recall, South America had the highest per capita rates for the longest time. And they're continuing to do better. Asian numbers are starting to decline slightly, as it seems like Indonesian numbers are getting a little bit better. Southeast Asia numbers are getting a little bit better. And you can see, actually, Australia and New Zealand numbers from per capita standpoint are now higher than Africa. Realistically, probably not, because the numbers out of Africa are probably really underestimated. But that tells you how serious that outbreak in Sydney. What's extraordinary about this outbreak is it started with one person. As far as we could tell, it started from one person who got through their very strict travel restrictions, went into Sydney, and it's Delta, and it just spread like wildfire, and it's now out of control. It's beyond the point where they can just, isolate certain people. They've gone into general lockdown, and it's still spreading. So from a per capita standpoint, these are the countries, the details. You can see that Georgia, again, continues to struggle. To me, anything over 500 is very high. Over 1,000 is extraordinarily high. That is some serious numbers, and Georgia is really struggling right now. Kosovo, Montenegro. So you can see that shift to Eastern Europe. Israel. And that is a concern. And this is what Delta has done. Now, Israel numbers are probably, again, I need to look into details into Israel, look at the hospitalization numbers, look at their mortality numbers. Those are still very low, similar to the UK. UK, yes, saw this huge surge. Their hospitalizations and deaths, yes, they surged, but not to the degree that they did before vaccines. And so that's something that we're going to have to get used to. We're going to get infections, breakthrough infections. In fact, I think that breakthrough infections are grossly underreported. I think we have way more breakthrough infections than the numbers indicate. And that's because breakthrough infection can only be detected through testing and screening. Okay, and remember, my definition of infection is that people have the virus replicating inside of them. They may or may not be symptomatic. In fact, the way I define it, infection is not symptomatic. If you become symptomatic, then it progresses to disease. And I think that's something that we should start doing, differentiating infection and disease. Infection is, again, virus is replicating, which means that you may be shedding virus, possibly transmitting it. Disease means you are actually showing signs and symptoms. So what we do know about the vaccines is that it may not be as effective at preventing infection, but it is still highly effective at preventing disease, serious disease, and death. Okay, so I think Israel, these Israeli numbers are, because they have a fairly robust screening system, a lot of those are probably infections. In fact, if we started more broad testing of the US population, my guess is our infection numbers would go up, would be very, very high. I think there's a lot of us walking around with infection who are vaccinated that we just aren't detecting. And by the way, that is why we need masks. Okay. So you can see these numbers. The US is on this list. We're about 460, which is not great. Like I said, 500 or so, to me, it's high. Of course, in larger countries like the US, it's going to vary quite a bit, as we'll see. The South is struggling, but the Northeast continues to do okay. You see the UK still up here. Yeah, so it's again, a lot of different countries from all over the world. By the way, a little bit of a concern, you're seeing a lot of small Caribbean islands on this list. You're seeing St. Lucia, Dominica, Cuba, which is, of course, a bigger island. You're seeing, let's see, Bahamas. So that's a concern. Those little islands, once infection outbreak sets in, it gets really difficult to control. Excuse me. Yeah, that is actually, Deja, thank you for that. There's a lot of vaccine diplomacy going on right now. And I think that's going to be really important. I think a lot of countries are wanting to make their own vaccines. And, there are vaccine makers that are actually selling their license to different countries. And I think that's a good sign. That's a really good sign. One of the challenges of that, and I don't want to get too off topic here, one of the challenges of that is that the mRNA vaccines are relatively difficult to manufacture. They're not, they're brand new, of course. The technology's been there, but not widespread manufacture. So it's a very delicate process. Not too many countries have the capacity to manufacture those. So, but again, as we make more, that technology should disseminate. So one of the big benefits of the Novavax vaccine, which is still yet to be approved by the FDA, that technology, the protein subunit technology, is actually widely used, and that can actually be manufactured by just about any country with a decent industrial base. So I'm really looking forward to that vaccine being approved because it might not make a difference in the US, but may make a huge difference globally. So in terms of changes, you can see that North America, particularly Canada is starting to see a surge. See Australia and New Zealand have a bit of a surge. Parts of Southeast Asia still are struggling, as well as you can see the disease rates of the surge has shifted in Europe towards Central Europe and Eastern Europe. Again, it may seem disconcerting to see all these highly vaccinated countries with large number of cases, but this is what Delta has done. And again, we need to start defining, okay, when we talk about vaccine efficacy, we need to start talking about it in terms of preventing disease and hospitalizations and death rather than infection, because it's relatively clear that yes, vaccination does lower infection. The risk of infection is lower if you're vaccinated. The risk of transmission is lower if you're vaccinated, but it doesn't eliminate it. Okay, so vaccinated folks can spread the disease. Vaccinated folks will get breakthrough infections. But, and this is the great news, it'll keep you out of the hospital. It'll keep you from having symptoms. It'll keep you from dying. Okay, so these are the countries that are seeing the biggest increases. You can see New Zealand. Again, New Zealand has such low numbers, 1,000% increase may not be a huge deal. You know that they went into a snap lockdown because of one case. I believe they came from Sydney to New Zealand. So far, they've been able to, Taiwan and New Zealand have been able to quash small little outbreaks relatively quickly and very effectively. Unlike Australia, which was unable to do so. We'll see where this goes with New Zealand. You can see a lot of little countries like Antigua, Sao Tome, St. Kitts. So again, when it seems like when COVID hits some of these smaller island nations, it really spreads very, very rapidly. So that's something to keep an eye on. And unfortunately, these countries do not have a whole lot of healthcare resources. In terms of deaths, Indonesia and the US are leading the way. See the details here. Asia continues to lead the way in deaths. North America is starting to go up, but we're nowhere close to Asia's in terms of deaths. And again, these are just counts, so keep that in mind. European deaths are starting to increase, not to the degree that it is in North America, which I think is indicative of the higher vaccination rates in Europe compared to North America, particularly the US. Deaths more than cases are going to be affected by vaccination status. Okay, I think we need to start looking at deaths and hospitalizations when we look at vaccination numbers. I think cases are no longer a good metric to see if vaccinations are effective because of breakthrough cases, particularly in countries that do a lot of screening, which will detect a lot of asymptomatic cases, asymptomatic infections. So we need to start looking at hospitalizations and deaths as a better metric for whether vaccination is effective. And this seems to show that, because European deaths, yes, it is increasing, but not to the degree that it is in North America. And if you look at the UK numbers, their deaths, yes, they did rise during their latest surge, but not to the degree that it did back before vaccination. So vaccines are working. And if you look at Israeli numbers, and unfortunately, I should have shared that, Israeli numbers are showing the same thing. Yes, you're getting a surge in cases. You are seeing increases in hospitalizations and deaths, but not to the magnitude that you saw earlier before the vaccines. So confirmed deaths, US and Indonesia pretty much head to head, which is not a very good indictment on US numbers. Indonesia is of course, has a fraction of the resources that we have and have some significant challenges in terms of healthcare because of the scattered nature of their populations. Lots of densely populated islands that are separated. So public health in Indonesia can be very, very challenging. Russia is third. Russia's interesting. I might have to do a special one on Russia because that's an interesting place. I think their numbers are kind of all over the place and highly unreliable given the nature of that government and its secrecy. Mexico, Brazil, again, Mexico's the same thing. It just seems there's a lot more deaths and cases, so which seems to indicates that they're not testing nearly enough and they're not looking for new cases. So it's interesting. In terms of deaths per million, Mexico, Southern Africa, the Caucasus region, parts of Eastern Europe, you can see from a deaths per million, North America is now number one. We have now surpassed South America. South America numbers continue to look better. They're continuing to improve. Europe is going up, but not to the degree that North American numbers are. And again, that is, I think, indicative of vaccination rates, excuse me. All right. And per million people, Sri Lanka is now number one. Iran, Cuba, Kazakhstan, Malaysia, Mexico, Russia. The US is up here, but we're kind of mid-pack right now at about 3.5 per million people per day. Thailand is right above that. Again, seeing Thailand and Vietnam up there is really sad given how well they have done up to this point controlling the pandemic. If you recall, a lot of us in the public health community lauded Vietnam's efforts in fighting the pandemic, but you can only do so much without vaccines. Like I keep saying, contact tracing, social masking, social distancing, restrictions are tools that work short term. They are not long-term tools. They cannot work for 2 years. Really, those are tools to keep numbers down so that we have time to get cures or vaccines. And these countries have done an incredible job doing that as long as they could. And now they're just coming up to the limits of those tools. So you can see the weekly change in death. I mentioned Canada. They're seeing a huge surge in deaths. Ontario hospitals are struggling. Yes, Canada is much more highly vaccinated than the US, but remember, Canada chose to use the UK strategy of vaccinating as many people as possible with one dose before worrying about the second dose. The thing with Delta, remember, is that one dose has very negligible protection against Delta. 2 full doses is very good protection, but 1 dose does not. So that may be what's happening in Canada. Even though they have much higher vaccination rates, many of those folks only have 1 dose, which leaves them not well protected against Delta. You can see the changes in deaths. These are the countries that are seeing changes. Again, a little bit concerning seeing a lot of small Caribbean countries in this list, as well as a lot of African countries. And African countries too. So, all right. So overall, I think patterns haven't changed too much globally. South America continues to do well. North America continues to do extremely poorly. Europe, things are kind of shifting towards Central Europe. Even Germany is seeing a little bit of a surge, and Eastern Europe. Asia continues to play whack-a-mole. Southeast Asian numbers are kind of stabilized, but Central Asia is starting to surge. Even Australia is struggling. Africa numbers, again, it's hard to read too much into Africa numbers. But yeah, I think the story, though, is the huge Delta surge in North America. We are again, as we have been for the longest time, through most of this pandemic, leading the world in cases and deaths. Okay, let's talk about vaccines. We're now at 5 billion doses. So we're slowly trudging along, vaccinating the world. That equates to roughly 2.5 billion people, a little bit more than 2.5 billion people now with at least 1 dose. This is still a long ways to go. You can see the countries with the highest levels of vaccination. This is 1 and 2 dose. So the dark part of the bars are fully vaccinated, and then the lighter part is partially vaccinated. So you can see UAE leads the way with 85% of their population, which I'm trying to figure that one out. because none of the vaccines are approved for children under the age of 12, even under EUA. But it also may mean UAE has very few children. And that may be the case. It's hard to, I don't know. It does indicate that most adults are vaccinated in UAE. Granted, it's not a great case study because UAE is kind of an interesting country. Portugal, though, is more comparable, and they have 82%. So there's some countries with extraordinarily high vaccine numbers. Iceland, Malta is a little, I mean, it's a tiny little island country. But you got Spain up there at 77%, Denmark, Uruguay, Chile, Canada. I mentioned Canada, 66%, and a further, 7.2% with one dose. So yeah, you got a lot of countries doing really well. Israel's now near the bottom, which is, they just haven't budged from this, 65 to 68%. There seems to be a high degree of reluctance, vaccine hesitancy in Israel, because that number has not changed in many, many months. So it seems like the rest of that population who aren't children are very, very vaccine hesitant. And I need to do a little bit more research on that. You do notice that the US is no longer on this list. It's pretty far down because we're only at about a little over half fully vaccinated. So not great. Of course, this is the bottom. And this hasn't changed either. There's very little progress in these countries. They just can't get their hands on vaccines. And again, notice that almost all of them are in sub-Saharan Africa, and with a few exceptions like Yemen and Papua New Guinea and Haiti. So vaccinations continue to trudge along, with most of the world. Now, I'm not saying that there isn't hesitancy in other countries. There is. European hesitancy numbers are really concerning, particularly in areas like France. UK actually has very little hesitancy, which is really, really good news. But even places like Japan have very high degrees of hesitancy towards vaccines. So the anti-vax movement has really spread globally. And I'll go over that polling later. Let's talk about US numbers now. There seems to be some indications that our current surge is starting to level off. I'm at a point where even slight changes in the slope of that curve give me a little hope. Okay, so that's doing okay. It looks not, I don't know, we'll see. It's hard to say if this will level off or will start continuing to go up as Delta shifts in May. What's concerning is the hospitalizations. So, you look at the UK, and I apologize, I didn't have that data. I should have shared that. If you look at UK case hospitalization, it really didn't budge too much. It did go up, but not to the degree that cases went up. And that's because the UK had much higher vaccination levels, particularly in their senior populations. Now, our senior populations has the highest levels of vaccination, but there are enough seniors who aren't vaccinated that they're now in the hospital with COVID, unfortunately. And of course, Delta's kind of shifted that to younger people. If you look at the hospitalizations, they kind of equal the magnitude of cases. And that's indicative of the fact that we just haven't vaccinated enough folks, especially in the regions where Delta is hit the hardest. Deaths are the same thing. Yes, if you look at the UK numbers, there was an increase in death, but not to this magnitude. And that, again, is indicative of the fact that we just haven't vaccinated folks. So by region, it looks like, good news. Mississippi has peaked and is going down. So that's good news because in Mississippi, the entire South has been struggling. And the South is starting to maybe plateau, possibly. The West actually is starting to go down, maybe. Meanwhile, the Midwest is starting to surge a bit. And the Northeast continues to do fairly well. It looks like it's starting to plateau as well. So it'll be interesting to see if, it's kind of, the USC is kind of this whack-a-mole thing where the surge in the South now shifts to the Midwest and then to the North. By the way, that Midwestern shift, a lot of it's South Dakota. Okay, I'm just checking my hopefully those on Facebook can hear me. I'm in my office. I don't have my fancy microphone, so I apologize. It's just going through my computer. FDA authorization. Debbie, I'll talk about that later on when we talk about the polling data. There's a couple ways this is go. We'll see. We'll see. All right. All right. Thank you, Nicole. So these are the hotspots. That hasn't changed. Look at South Dakota. Look at Western South Dakota. Guess what happened in Western South Dakota? Bunch of Harley riders decide to go. Like thousands, hundreds of thousands. I don't know, a lot of them. Not much masks, a lot of parties, probably low vaccination rates. And then this is what happened. You know, what's really frustrating about this is the same thing happened the last time there was surges, and South Dakota became the hottest of the hot spots. I can understand mistakes, but not learning from your mistakes. And Governor Noem seems to be incapable of learning from her mistakes, and she's made a lot of them. I mean, if she could learn from her mistakes, she'd be one of the most intelligent people in the world because she's made a lot of mistakes, but she hasn't learned from one mistake, quite honestly, as far as I can tell. Yes, I'm not the biggest fan of Governor Kristi Noem at all. She's right up there with Governor Abbott and Governor DeSantis, quite honestly, in the eyes of most public health folks. By the way, Nebraska, you're thinking, wow, what's Nebraska doing? They are doing awesome. You can really look awesome if you don't report data. And that's what they're doing. Nebraska has basically said that counties are not allowed to report county level data. Nebraska is just reporting data from the entire state and a few urban areas. That's what Nebraska is doing. So there's a lot of data games. Florida is only reporting numbers once a week. Same with a few other states. I was frustrated with Utah because we only report data during weekdays, Monday through Friday, and Saturday, Sundays kind of lumped together. But that's not nearly as bad as Nebraska or Florida. And Texas too, by the way. It's really frustrating, the political games that are still being played. So you can see it surges. The South continues to surge. It's spread into Texas now. But you can see it's spreading upwards into Kentucky and Indiana, Southern Illinois. So the concern now is that will it spread into the upper Midwest, which to this point has been doing really well. The Northeast continues to do well with the exception of a few rural areas. But trust me, this region of Maine, there's like 3 people there. So, I mean, I exaggerate, but it's a very sparsely populated area. We'll see if the surge goes into Massachusetts. You know, given what's been happening in Israel and the UK, it's no longer outside of the realm of possibility because even highly vaccinated areas are seeing surges. The good news is highly vaccinated areas see surges of infection, but they're not seeing surges of significant surges of hospitalizations or deaths. So that's the good news. You can see Wyoming is starting to really flare up, and it's starting to spread into Idaho. Utah, we've been breaking 1,500, and that's not a great thing. Oregon as well, particularly Western Oregon. If you know, a lot of people look at Oregon and Washington as very, liberal progressive states, but it's almost 2 states. You have the areas around Portland and Eugene, and then the rest of the state, which is much more conservative. Same thing with Washington. It's almost like 2 different states, really, divided by the Cascade Range. So yeah. Okay, so that's the national picture. By state, you can see Florida is leading the way with 22,000 cases a day. It's not increasing as sharply, so that's good news. It's only increased 6% in the last 2 weeks. Texas is second at 16,000. California, Georgia's kind of surged at 54%. From per capita, Mississippi still number 1, along with Florida, Louisiana, Tennessee, Kentucky, South Carolina, Georgia. So the entire South, essentially. Yeah, and Wyoming and Alaska. Yeah. Arkansas has seen a decline. Very few states saw declines. Missouri and Arkansas saw a decline. That's because they were so high in the last few weeks. It seems like their surge may have crested. If you look at the other end, The lowest, Maine, Maryland, Connecticut, Vermont, New Hampshire, Michigan. So you're looking at the upper Midwest and the Northeast with the lowest numbers. Okay. Yeah, almost exclusively, along with Colorado's up there as well. They've all seen increases, but not nearly as high as these states. You were looking at 108 per 100,000, 105 per 100,000 per day. And, Maine's at 15. So roughly, a sixth of Mississippi's rate. In terms of changes, with the exception of Guam, South Dakota has the greatest surge, along with West Virginia and North Dakota. Those are three states with some of the lowest vaccine numbers. South Dakota, of course, saw Sturgis. And it's hard not, I don't think you have to be the world's most brilliant epidemiologist to figure out, hey, that was a super spreader event. It probably is. So you're probably going to see numbers surging even higher than that. And it's worse than the original outbreak, the first outbreak out of Sturgis, because we're now talking about a viral strain that is 2 to 3 times more transmissible. So one person shedding virus in a small bar without a mask on, unvaccinated, has the potential to spread it to everyone in that bar. Yeah. Anyways, as far as hospitalizations, Florida leads the way, 17,000 daily. That is not a small number. Texas is second, 13,000. California is, because California is so large and populous, is third, and then Georgia. If you look at per capita, Florida leads the way, Alabama, Louisiana, Mississippi. Sounds familiar. Again, you're seeing surges in hospitalizations in these states because of, look at Alabama, 37% fully vaccinated. I mean, even Florida at 52%, which is about average for the US, it's still seeing a huge surge in hospitalizations. But Alabama, Louisiana, Mississippi, yeah, those are, there are very few people vaccinated. So that's going to reflect in death numbers and hospitalization numbers. Here's the death numbers. Like I said, these are daily deaths on average, 240 deaths per day. And then per capita, Louisiana is number 1, Mississippi, Florida. Again, the pattern continues. States with the lowest vaccination rates are going to see the highest hospitalization numbers. So the US patterns have not changed too much. It's really the Southeast driving it, but you're starting to see it spread up into the Midwest. And the West is kind of, there's some hot spots, particularly, South Dakota and Wyoming. Utah starting to surge a little bit. You probably noticed we're now 1,500 cases a day on the peak days. I considered Wednesday, Thursday, Friday peak days. Those are the numbers I really pay attention to, and they weren't great. We were at 1,500. Okay, what about vaccinations? So let's talk about vaccinations because this is really important. A lot of news came out about vaccinations. 203 million doses. 23 million people have received one or both doses. That's only 52% fully vaccinated. You compare that to, say, a UAE, and can we get to 80% right now? No, we can't, because the population of children in this country is too high. We probably can't reach that point, but 52% we still have a long ways to go. Are we making progress? Will the FDA approval, full FDA approval of Pfizer, change it? Will more mandates come out? Will that increase numbers? We're going to have to talk about that. So by age groups, you can see at least one dose, 61%. That's not, again, we have a long ways to go. 12 and up, it's 72%. 18 and up, 74%, which means, 26% out of eligible adults are still not getting the vaccine. 65 and up, it's 92% and 81%. That still leaves a large number of seniors who are still extremely vulnerable to COVID. Okay, 81% fully vaccinated. I really look at the fully vaccinated because with Delta, one dose isn't going to do much. Fully vaccinated, 81%. That leaves 19% unvaccinated. That's a fairly significant portion of the US population that is in really high danger of severe disease and death because of the level of virus circulating in the population. Some good news, you can see a slight uptick. We're about 880, almost 900 doses, 900,000 doses a day, which is better than the 500 that we were at just a few weeks ago. So there has been slight increases. And the good news is that the increases, the biggest increases, are in areas with the lowest levels of vaccination. So you can see this number is the percentage point increase in people vaccinated between June 6 and August 21. So you can see that Florida, Texas, Louisiana, Mississippi, those are the states that needed it the most, and they vaccinated the most. So that's really good news. Okay, now this is not caused by the full FDA approval, because that obviously only happened recently. This is just flat out fear driving these folks. These are the states that are surging with Delta. These are the states where hospitals are overflowing. These are the states where it's harder and harder to live there without knowing someone who isn't on a ventilator, who hasn't died of COVID. That may be the most powerful motivator. Short term, it may be the most powerful motivator to get vaccinated. It's just sheer fear, or that contact with someone who suffered from it. I wish we didn't have to get to that point. In fact, I consider that a failure of public health, that we have to, people have to see people dying before they decide to protect themselves. But right now, I'll take what I can get. And it's sad, but if that's what it takes, that's what it takes. That was a little depressing, I know. So you can see Mississippi, weekly first doses went up 227% from June 6 to August 15. 11% increase in the population vaccinated. Louisiana, Arkansas, Alabama, again, all states where Delta is surging and also had very low vaccination rates. So that's kind of spurred a lot of those folks who are hesitant to get the vaccine. Utah's even up here. We're at plus 9%. So we've done a good job of vaccinating more folks in the last few months. Now that one probably isn't due to fear, because we haven't had the huge surge that, say, Mississippi or Louisiana or Arkansas has. So it's kind of interesting what's driving the Utah numbers. Be curious to look at that, actually. So this is the changes in weekly new cases and first vaccination. So this x-axis is increases in vaccination. So further along, like Mississippi had the highest increase in vaccination. The y-axis is percent increases in new cases. So clearly, there's a nice correlation here between increases in new daily cases and vaccination. Yeah, sheer fear. People knowing somebody who got COVID, who's on a ventilator, who's in the hospital, that's going to drive people to vaccinate. So you can see a clear association here between how much Delta there is and increases in vaccination. Now, like I said, why Utah is an interesting case, because we've seen a significant increase in vaccinations, but we haven't had the huge surge. So that's, I think, something that's worth looking into. I'm not quite sure what is causing that. If anybody has any ideas, I'd love to hear it so I can pass it off as my own. Okay. So this is the vaccination map. So good news is this is getting a little bit more filled in, which indicates that they are vaccinating more. There's less of a difference between this area and the Northeast in color. For a while, it's very distinct, much lighter color here, much darker color here, indicating that the South was not vaccinated. But it is starting to get better. We're nowhere near where we need to be, but its vaccinations seem to be increasing, which is good news. By state, yeah, it has improved in the South. So Mississippi is no longer at the bottom. West Virginia and Wyoming are. Remember the early in the days when West Virginia was lauded for their high vaccination rates? Yeah, what happened to that? It's interesting. It's simply a function of them reaching out to the folks who really wanted to get vaccinated early in the first place, quicker than other states. That's really it. West Virginia always has been a much more hesitant state. A lot of distrust in public institution in West Virginia, a lot of poverty, and that's reflected in the low vaccination rates. Utah is, again, kind of middle of the way, middle of the pack, about average, right by with Florida, right alongside Florida, which, yeah. So, but yeah, again, pretty vast differences. Hawaii, at 87% of those 18 and over are now vaccinated versus, 55% in Wyoming. That's a more than 30% difference. And that's, yeah. And Wyoming, of course, is a very different place than Hawaii, very different attitudes. All right. So vaccination in general, there's some good news. There's an increase in the rate of vaccination. Now, whether FDA approval has changed attitudes, we're not going to know until we see some data in the next couple of weeks. The other thing, of course, FDA data may kind of change the mind of some of those folks who are sitting on the fence. We're going to see that detailed data in a bit. I think the bigger effect of the FDA approval is that it triggers a bunch of vaccine mandates. The reason why Westminster College, of course, announced our mandate is because we were fairly certain that FDA approval was going to come up in the next couple of weeks, and it did. So we do have a vaccine mandate. You are required to vaccinate by October 15th, or the consequences are, honestly, you will no longer be a student here, and you will no longer be an employee here. And that is what it is. Luckily, most of the community is already vaccinated, but there's some folks who are going to have to make a hard decision, quite honestly. But there's also the vaccine mandate in the military. All active duty personnel are now required to be vaccinated, which I'm not quite sure why they didn't do that earlier, because the military is notorious for injecting folks with stuff that even the soldiers don't know what they are, because I guess informed consent isn't a thing in the military. I don't know. A lot of schools, at least in places like New Jersey, New York, students will have to be vaccinated. All faculty and staff will have to be vaccinated. Delta Airlines actually no, but they are charging those employees who do not get vaccinated $200 more per month for their health insurance. And they say that that's to compensate for the fact that they've had to pay for so many COVID hospitalizations. So that might be the bigger effect of the mandate, is the FDA approval, is that it kicks in a lot of mandates. Okay, a lot of colleges, although we are still the only one in Utah with a vaccine mandate, we are now one of two with the mask mandate, because BYU did announce a mask mandate. None of the publics have announced a mask or vaccine mandate, because, of course, publics are beholden to our state legislature, and our state legislature is misinformed. That was the nicest way I could say that. Okay, let's talk about Utah. Utah numbers are surging, not as much as the rest of the country, particularly the South, but it's surging. My big concern is this hospitalization. The hospitalization numbers are much higher than even cases, which is really, that might indicate that Delta is maybe more severe. But yeah, that's really concerning. The hospitalization numbers are almost matching the peak that we saw last winter. Deaths are also increasing. Now, we've never had too much of an issue with deaths in Utah because we are a younger population, but it seems like Delta is really shifting that. We're seeing younger people in the hospital. We're seeing younger people on ventilators. We're seeing younger people dying from Delta, mostly unvaccinated. So county by county look, of course, Salt Lake County is leading the way. Utah County second. That makes sense, given that Salt Lake, Utah, Davis, Weber, and Washington are the 5 most populous counties in Utah. In terms of per capita, however, it is the rural still leading the way. Sevier, Daggett, Duchesne, Sevier County only has 31% of its population vaccinated. Daggett County is a little bit better, but Duchesne, Emery, Kane, Millard, those are all have very low vaccination rates, and they're surging right now. Particularly Emery and Kane, we're seeing 1,000% increases in the number of cases. Again, it doesn't equate to a lot of cases because those are very sparsely populated counties, but yeah, Tooele County is seeing a bit of a surge. Wasatch County. So you can see that, as far as Wasatch Front counties, we're kind of middle of the pack. Utah County, Davis County first, then Utah, and then Salt Lake. Which makes sense given the high levels of vaccination in those counties. Summit County is pretty far down, but Summit County also has the highest levels of vaccination. You can see the surges here, the counties with the biggest surge. In terms of hospitalization, Washington County has the highest hospitalization per 100,000. That makes some sense because it is also the oldest county, I believe, in Utah because there's so many retirees going down there. Then Kane County, Iron County. So you can see that Salt Lake County is a little bit further down in terms of hospitalizations. Some of that might be skewed because because so many referral hospitals are in Salt Lake. So Salt Lake will get the most severe cases. I'm not quite sure if they count that, if they adjust for that. I imagine they do, but I should check. In terms of deaths, number of deaths, of course, Salt Lake is leading the way because we are the most populous county, then Davis, then Utah. But from a deaths per capita standpoint, again, it's the rurals. The counties that have very low levels of vaccination, like Millard or Juab County only has 27. And that number has not budged as long as I can remember. That is just a county that refuses to get vaccinated for various reasons. And that's going to get reflected in hospitalizations and deaths. Okay, so you can see, yeah, Summit County is up here in terms of deaths, but again, I think that's due to the fact that Summit County is an older population too, so that's got to be considered. That's the other thing about Juab and Millard counties; those are fairly young populations. Yet you're seeing high death rates. Test positivity, it's on the rise again, which makes sense. Above 10%. This is test. Hospitalizations again rising, really a huge concern. I know I think the ICU is 91%. So please don't plan on getting into a car accident soon because they may not have room for you. There's a lot of talk about triaging and prioritizing folks who've been vaccinated over unvaccinated. Now, the angry part of me says, damn straight, but the more rational part of me says that's a problem. We're going down a slippery slope there. I don't know. I got to think about it more. That just sounds horrific that we are going to prioritize those who are vaccinated over unvaccinated. It does make some sense under some ethical models, but honestly, I wish we never got to this point. And we didn't have to get to this point. So it's frustrating. Okay. And this is deaths. So again, we are seeing a surge in deaths too in Utah. And that is a concern. And this just shows what we've been seeing. It's all Delta all the time. They turned Delta hot pink. And yeah, it's just about all Delta. Kind of keeping an eye on Gamma. Because I saw some worrying numbers out of Brazil looking like Gamma numbers are increasing. So I'll have to look at Gamma a little bit. Maybe next week I'll look into that a little bit. But so far in the US, it's mostly Delta. Delta is the king of the variants right now. I mean, and when a variant can spread to twice as many people, yeah, that's a huge advantage. Okay, so that's Utah numbers. We are starting to see a surge. I'll be curious to see today's numbers. But the danger is as we see more cases in Utah, we're going to see more breakthrough cases. So everyone needs to be careful. What's really frustrating, of course, is that we just don't see masks in Utah. It's not uncommon for me to go into Smith's or Home Depot, especially in Utah County, and be the only person wearing a mask outside of the employees. Home Depot employees, of course, are required to wear masks. At Smith's, not even the employees are wearing masks. I see people in scrubs, obviously off shift, not wearing masks with their 11-year-old or 10-year-old kids. That's incredibly frustrating. All right, we are trudging along in terms of vaccinations in Utah. Trudging. Only 60% of those over the age of 12 are fully vaccinated. Seems 40% are not. Our vaccination, we have seen a little bit of a surge, not a huge amount. We're about 10,000 doses per day. Nowhere near the peak that we saw, 40, 45,000. So that's why I say we're trudging along, but it seems like there's just a lot of folks who are just hardcore resistant. You can see again, Summit County leads the way, and then Grant County's done, the Moab area has done a phenomenal job of vaccinating because they're now second, still pretty far back of Summit County though. And then Salt Lake, Davis, out of the Wasatch Front counties, you got Daggett and San Juan are doing pretty well. Near the bottom, like I said, Juab County has not budged from that 27. Maybe they were 26 for a while, and then they went up 27. San Pete, Paiute, these are counties that just, I don't know what's going to take for the folks to get vaccinated there. Now, some of it could be just the fact that these are incredibly remote counties. It's a trek to get anywhere in those counties. For example, if you live in Boulder, Utah, it's probably a 2-hour drive to the nearest big grocery store. So, you got to consider that factor as well, which also means that we're not doing a good job reaching these folks. We should have mobile vaccination clinics. We should be going door to door. As much as Fox News thinks that we're going to take away Bibles and guns, I assure you, we are not. We have no interest in your Bibles or your guns. We just want to give you a vaccine, and we want to help you stay healthy. Yet this message seems to be lost somewhere, and we are now gun and Bible confiscators. Yes, that's a little bit of frustration in my, It's young people who continue to lag behind. The 12 to 15 age group is starting to get vaccinated. That's increasing at the highest, at the highest rate. So that may be parents realizing, wow, my kids are going to school, no one's wearing a mask. I'm really scared for them. They're getting vaccinated. But it's honestly, it's the 19 to 29 and 30 to 39 age groups that are the most frustrating for me, because you can see their vaccine uptake has increased slightly, but not enough. The 12 to 18, you're seeing you're seeing them catch up to the 19 and 29. So it looks like they are starting to realize that vaccinations are helpful. But again, it's those younger age groups that are just not budging. They're not getting vaccinated. And it's incredibly frustrating. When I show you the polls, it'll show that. And this is, of course, breakthrough infections. And I do love the fact that the state of Utah is now publishing relative risk. So those who are unvaccinated are 5 times at greater risk for testing positive, almost 6 times greater risk for hospitalization, and 6 times greater risk for dying. Those numbers seem low compared to other states. And I still haven't, I said I was going to try to figure that out, and I still haven't figured that out, why that's the case. It could be that we're detecting more breakthrough infections. And that might be it. I mean, we're probably doing more testing than, say, Alabama or Georgia. And therefore, we're detecting more asymptomatic cases, which would tend to kind of attenuate these numbers. That could be. I'm going to have to look into that. So those are the numbers, and the 95% confidence level. Yeah, those are a little bit lower than I like to see. But again, we need to get used to the fact that as more infection circulates in the population, the more breakthroughs are going to happen. Okay, so those are Utah numbers. I'll be curious to see what today's numbers are, but right now, they are on the rise. hopefully we don't see the same situation that we're seeing in Alabama. By the way, the South is going to have another whammy, and is it Hurricane Ida? I think it's Ida, yeah. Just reached hurricane strength, and I think it's supposed to hit the Gulf Coast early next week. COVID combined with mass evacuations is a recipe for disaster. That's what they're looking at right now. Boy, being in public health in the South is just a huge challenge right now. All right. So I promised you, well, the one thing I wanted to, I really wanted to go over a couple of things here in terms of news, and I'll try to cover both these topics about 15 minutes each, so I don't go past 1:30. The first bit of news is, okay, this entire controversy around whether breakthrough infections can actually spread the disease. A lot of folks think that breakthrough infection spreads disease as easily as non-breakthrough infection. So vaccination does not make a difference in transmission. So I want to kind of go over that and some of the data surrounding that. Can a breakthrough case transmit disease? Do they have equal viral loads? The short answer is breakthrough cases can transmit disease, but not as easily compared to non-breakthrough cases. Okay. So first off, this is, we have to emphasize, and these are the first studies that show that there is a slight reduction in vaccine efficacy against Delta. But for hospitalization, it is still incredibly effective. So you can see that, yeah, against vaccine effectiveness, any vaccines, about 80% effective. Okay, this is the Delta variant, about 88% effective. The Pfizer is about 88%, and then the AstraZeneca about 67%. So it seems like there's a slight reduction, but not significantly. These, especially against disease. So this is another study out of the Morbidity Mortality Weekly Review in New York, looking at cases and hospitalizations. And you can see this is 18 to 49. This is 50 to 64, 65 plus, and all adults. You can see the dotted line here, the dashed line, I should say, is cases per 100,000 among the unvaccinated. Again, this is hospitalizations. This solid line is cases per 100,000 in the vaccinated. You can see significant difference in the rates in 18 to 49, in the 50 to 64, in the over 65, significant difference. So basically says that, and this is hospitalizations. I'm sorry, this is cases. This is hospitalizations. So you can see, and this is, again, you look at the hospitalizations, this is the dashed line, the solid line. The dashed line is unvaccinated, the solid line is vaccinated. The solid line is close to zero here. It's close to zero here, close to zero here. And here's the dashed line. So against hospitalization and death, these vaccines are still extraordinarily effective. And study after study after study shows this. This is looking at efficacy in nursing homes before and after Delta. You can see, yes, after Delta, it's slightly reduced. Okay, it is reduced, but this is just infection. This is infection. Remember, if efficacy in infection is going to be the lowest, okay? And this is why I say maybe we should stop using infection as an endpoint to determine vaccine efficacy. We should look at hospitalization. We should look at disease, so symptomatic disease, hospitalization, and death as endpoints. And when we look at those metrics, these vaccines are extraordinarily effective. So this is why I say there's probably a lot more breakthrough infections than we think. People walking around with infection, but because they were vaccinated, it never progresses to even symptoms, but they could potentially spread it. This is LA. Again, looking at persons aged greater than 16 years by vaccination status. So unvaccinated is the dark black dashed line. The solid line is fully vaccinated. And again, these are just infection, okay? Infection. This is hospitalization. These are still extraordinarily effective. Okay. Now, what about transmission? Okay, so we've said that these vaccines are extraordinarily effective at preventing disease, hospitalization, and death. They are. What about infection? Can they spread it? So that's a really important question from a public health standpoint. Can vaccinated folks with breakthrough infection spread disease? If they can, are they spreading it to as many people as an unvaccinated person with infection? So this is the original Barnstable County study that kind of started all this. And I do have some issues with the study because they did look at, so they, one of the issues that I had was how it was reported. They said, well, 74% of all COVID-19 cases occurred in fully vaccinated persons. And you're thinking, oh my gosh, 74% of all of them were breakthrough? The vaccines don't work at all. But really, that's a horrible way to make comparisons, because what if most of that population was vaccinated? And which is the case. This population was highly vaccinated. We don't know what degree, but if, say, 80% of this population was vaccinated, yes, of course, you're going to get more breakthrough cases because most of those folks were unvaccinated. It was just a simple denominator issue. It's just, it's frustrating because this is what I teach in EPI. So that's one issue I had. The other issue was when they so one of the things that the CDC took out of this was they looked at cyclic threshold. Cyclic threshold values are basically a measure of viral load. So literally the number of viruses people have inside their body. And we can actually, when we do a PCR test, we can actually detect, okay, how much virus is actually circulating in their body. So cyclic threshold value, the lower the cyclic threshold value, the higher the viral load. So it's kind of an inverse association. Okay, so this is the cyclic threshold value. This is among the unvaccinated. This is among the vaccinated. And they said, oh my gosh, they're equal. Okay, they are equal. However, and this is the problem I have with the study, it was that one time during whenever they were diagnosed. Now, but does it last? And there's some other studies that actually counter this. Now, this one had relatively low ends, 84 unvaccinated, 127 fully vaccinated. Not a huge number. This is from the REACT study in the UK. So this is round 13. This has about 20,000 people. And they also looked at, by the way, they also found that the vaccines are still highly effective against Delta in terms of hospitalization and death. But they also looked at cyclic threshold. And let's look at the cyclic threshold here. Here it is. So the mean cyclic threshold, and we're going to look at all data here, not vaccinated versus 2 doses vaccinated. They found, and this is based on a lot more people, 34,000 people, 145 vaccinated. Okay, so maybe not so yeah, slightly higher numbers. But anyways, they found that those with 2 doses of vaccine have a higher cyclic threshold value, which means that they have lower median viral load. Okay, so there's questions as to whether viral load changes. Viral load is different in vaccinated and unvaccinated. Those 2 studies are telling us different things, which is not uncommon in science, especially on new science. And this is very new science. Now, there's a couple other studies. So this one is out of Singapore, and they actually looked at, okay, so they did something a little bit different. They basically took multiple samples at different times, okay, to determine, okay, cyclic threshold value. So over time, what is the viral load in a person? Excuse me once. Sorry about that. That's the phone. I'm just going to let it ring, so I apologize for that. So this is interesting. So The red is unvaccinated. The green is vaccinated. So you notice that the cyclic threshold value is kind of the opposite here. What this is saying is that, yes, at the initial point of illness, viral load is the same. However, in the vaccine breakthrough cases, that period is much shorter when they have high viral load than in the unvaccinated. So basically, your viral load goes down dramatically after a much shorter period of time if you're vaccinated than if you're unvaccinated, which means that transmission is much less likely if you are vaccinated. Another study shows the same thing. This is out of the Netherlands in healthcare workers. They did the same thing, same results. Here are the vaccinated, here are the unvaccinated. Notice, yeah, at the beginning, okay, so this is actually culture positivity. So this is basically saying the same thing. The period, so yes, maybe initially those who are vaccinated and have a breakthrough infection have the same viral load as unvaccinated. However, that period is much shorter in the vaccinated, and their viral load drops off fairly rapidly. Bottom line is that breakthrough infections, transmission can occur. However, the possibility of transmission is much lower. I'm not going to say it's zero, of course, because nothing is zero. There's still a potential for transmission, but it is at much reduced level than among the unvaccinated. So unvaccinated infected person is much more likely to transmit the disease than a vaccinated infected person. And that's a huge deal in terms of public health. Okay, so individually, you should get the vaccine because it protects you from going to the hospital, from getting on a ventilator, from having symptoms. But from a public health standpoint, it helps you reduce transmission. Even if you do get a breakthrough infection, you're not as likely to spread it to other people as someone who's unvaccinated. So these are really important points. Okay, that's what the data right now tells us. Okay, I'm very demonstrative, yes, I know. Okay. So that's the takeaway message here. Vaccines are highly effective against disease. Well, number one, we need to start thinking about what the proper endpoint is to determine vaccine efficacy. Is it infection? Is it disease? Is it hospitalization? Is it death? My opinion, we need to stop emphasizing infection, start emphasizing disease, symptomatic disease, hospitalization, and death. If we use those endpoints, these vaccines are highly effective, highly effective. Number two, these vaccines, in fact, yes, if you do have a breakthrough infection, you can spread the disease, but the probability of you spreading the disease is much lower than if you were unvaccinated. Okay, so I think those are the takeaways here. That and get vaccinated. All right. My final news I want to cover is a couple of polling outfits who've been polling vaccine hesitancy. And what's nice about these polling organizations is they've been doing this since the beginning, since before the vaccines were even EUA. They've been following this data. So we have some really good longitudinal data on how attitudes have changed. And this is specifically for the US. So please don't, if you're looking at Canada or UK, these don't apply. We have a very unique culture. This is just for the US. So you can see who remains unvaccinated. And you got three groups. Unvaccinated adults, wait and see, and definitely will not get the vaccine. So you got total unvaccinated adults. And then among the unvaccinated adults, you got those who say they're going to wait and see, and those who say they are definitely not getting the vaccine. All right. So you can see that they tend to be younger, 30 to 49. 18, well, really 18 to 49. They're much more likely. The older you are, the more likely you get vaccinated. There's multiple reasons. Number one is older folks. A lot of older folks remember polio and remember some of these vaccine preventable diseases. Number two, they realize that they're at the highest risk for disease. So they are most likely to get vaccinated. And remember, so this is where the politics don't quite, is less relevant, because remember, people who are older tend to be more, Republican, and this is the segment of the population who are less likely to vaccinate. So it seems like the being older trumps that. Sorry, no pun intended. That pun was not intended. I apologize for that. That was bad. All right, ethnicity, mostly white. Okay, party identity, mostly Republican, less likely to have college degree, lower income bracket, less likely to be insured, more likely to be in rural areas, and more likely to be white evangelical. So that's kind of a profile of the unvaccinated: younger, more Republican, less educated, more likely from rural areas, and more likely to be white evangelists. Okay. Now, looking at adolescents, about 4 in 10 parents say their adolescent has already received COVID-19. So we're looking at 12 and older. So that's good news. About 34% already vaccinated. Okay. 8% right away. Great. 18% wait and see. So that's the one that's going to be able to, we're going to be able to sway that group. 10%, that's where the mandates come in. Only if required. That means that if we throw out mandates, they may get vaccinated. And then the 25% definitely not. That's the tough one. Can we reach those folks? What about children under the age of 12? So good news is 27 says right away. 33 says wait and see. So that's about 60%. Okay. What we discovered about the wait and see is that most of those folks will decide to get the vaccination. That's what the longitudinal data from the survey says. Most of that group that said wait and see back in December, most of them have gotten vaccinated. So that's really positive. But then you got the 11% only if required, and definitely not. That 11%, they'll probably get vaccinated if schools start requiring it. The 26%, it's hard to say if they will ever get vaccinated. I mean, they're going to have to, right? I mean, if schools start mandating vaccines, either that or you start homeschooling. So it's hard to say. Okay, this is, okay. Have you personally received at least one dose or not, of the vaccine or not? And this is asking specifically about FDA approval. And this is, intended to get vaccine ASAP. So 92% of them already got the vaccine, and that's not really a group that we're really concerned about. Wait and see in January. 54%, like I said, already have received one dose. A vast majority of them still want to wait and see. So that's interesting. And then only if required or definitely not in January, most of those folks have already said will not definitely get the vaccine. Although there's still, 9% saying that it's wait and see, and then there's 16% that says they will get it if required. So that's some good news. Again, this is, again, vaccine intention 6 months ago. So among those who are vaccinated, 5%, this is, okay, so this is vaccinated, unvaccinated. And these are the groups that in January, what they identified in January. So this is only if required. The 5% are only, they said back in January that they would do it only if required. They're vaccinated. 16% are the wait and see. And then 47% are, vaccinated ASAP. So that makes sense. Of the unvaccinated in June, 16% are only if required, and then 17% wait and see. So there's still this 17% that we may still be able to sway. And if the data shows, a lot of them will get vaccinated. What they're waiting to see, well, some of it may be the FDA approval. Okay. Now, 1/4 of that unvaccinated adults. So this is actually good news. So these are all unvaccinated adults. Okay. How likely do you think that you'll get the COVID-19 vaccine before the end of 2021? 13% said very likely. 13% said somewhat likely. Okay. So those two groups, the 26%, about a quarter of unvaccinated folks, looks like they will get vaccinated before the end of the year. However, you got 10% that say somewhat unlikely, 15 that says very unlikely, and then almost half of them said they would definitely not. So about half of all unvaccinated folks said they will never get the vaccine, essentially. And that's not great. So full FDA approval, will this make a difference? Well, let's take a look. Here's the wait and see group. People who say they would more likely to get the vaccine if FDA approval. So 49% of the wait and see group right now would get the vaccine, or more likely to get the vaccine if emergency, if the FDA did formal approval. So that's good news. If they were entered into a lottery for a chance for $1 million, 31%, that's not bad. If a mobile vaccination clinic came to their neighborhood, 22%, that's great. So again, I think we can't characterize the hesitant. They're a very diverse group. There are folks within that group that will get vaccinated with the proper incentives or the proper disincentives. Okay, we can't basically say all people who aren't vaccinated now are anti-vaxxers. Some of them are hardcore anti-vaxxers that I myself will never be able to convince. Someone else may be able to, but I don't have those skills. But we need to reach those that we can and get as many people vaccinated as possible. Now, as far as vaccine safety perceptions, hasn't changed much. Little bit more confidence in the vaccines in July compared to April. So, 3% increase in Pfizer. Not so Pfizer seems to be the most trusted, and Johnson & Johnson seems to be the least trusted. And there's been about a 3% increase in the trust levels for Pfizer. So that's good news, I guess. All right, so that's the Kaiser polling. So there's some good news out of there. The takeaway there is that, again, there seems to be a segment of the wait and see population that this will give them more confidence in the vaccine and they may get vaccinated. So we may see a slight surge. The mandates, however, I'm still convinced that the mandates are going to make the biggest difference. If you want to travel, you're going to have to get a vaccine. If you want to work for this company, you're going to have to get a vaccine. If you want your kids in the school, they're going to have to get a vaccine. Those are probably going to have a bigger impact than, people being swayed by FDA, saying that, oh, well, EUA, I'm nervous about, but FDA approval, I'm really much more confident about. There's already signs that some folks are already moving the goalpost saying that, well, I don't trust the FDA. Well, but those folks might be the hardcore anti-vax folks as well. Now, I found a series of polls that I didn't know about. This is done by a collaboration of four universities: Northwestern and Northeastern, Rutgers, and Harvard. And this is more specific, more targeted polling. And this one, there's a couple of really interesting ones here. There's a bunch of them, and I might not be able to go through a lot of them today, but I'll try to go over them next week as well, because there's some really specific ones. This one's on vaccine misinformation and trying to correlate that to whether, hesitancy. So here are some of the most common misinformation about vaccines out there. Okay, so percent of respondents who believe each statement is accurate, inaccurate, or say they are not sure. So COVID-19 vaccines can cause infertility. COVID-19 vaccines will alter people's DNA. COVID-19 vaccines contain lung tissues of aborted fetuses, and COVID-19 contains microchips. So basically it's saying that 11% of folks think that it makes you infertile. 10% of poll folks say that it changes all DNA. That 9% believe that it contains aborted fetus lung tissue, and 8% thinks that it has microchips. That's a lot of people. And then, of course, the good news is that 52% of the fertility answered that no, it's inaccurate in terms of fertility. 63% say that DNA, it does not alter DNA. 60% says it does not contain aborted fetuses, and 70% say it does not contain microchips. I guess, however, the 37% 26%, 32%. The not sure part is, to me, I almost lump that in with the accurate part, that people are unsure about that. And that makes me really nervous. So a lot, misinformation is working. There's a lot of folks out there who believe this stuff or unsure about it. I would have liked to see this inaccurate part much bigger, but it's not. You have people who are unsure. That's really, yeah, that's disconcerting. Excuse me. Now, in terms of vaccine status and the number of misconceptions, as you would expect, people who do believe some of these are less likely to get vaccinated. But there are folks, for example, so these are, they don't believe any of those myths. They believe in one of the myths, or they believe in two or more of those myths. So obviously, those who don't believe in those myths are much more likely to get vaccinated, okay, 70%. However, there are still those 15 that are still vaccine resistant who don't believe those myths. Now, to me, what's interesting is this, the two or more, they believe in two or more of the myths, but 46% still got vaccinated, even though they believe two or more of those myths, which I found really curious. Yeah, I can't make heads or tails of that, actually, because that's really interesting. 42% they won't get the vaccine, or they're vaccine resistant. That makes more sense. But this 46 that got vaccinated, even though they believe two or more of those myths, is really fascinating to me. Now, if you hold misconceptions, you are more, if you hold them, you're more likely to be resistant. If you hold no misperceptions, you're less likely to be resistant. You're much more likely to get the vaccine. This is kind of an obvious one. Let's break it down by race, gender, race, and age. So again, those basically in the red are saying that at least one misinformation item is true. Of the 4 misconceptions, at least one is true. These are this color, the 40% is those who marked none as true, but at least one is not sure. And then 40% is correctly marked that all those items are false. This is really concerning that there are folks who are unsure of these, 40% of the population. So you break it down by gender, and that's really interesting. Women, so more men believe at least one is one of those items is true. However, women, there's a large group of women that are much greater portion of women that are unsure. Okay, if you look at race, African Americans are more likely to be unsure and less likely to say at least one item is false. I'm more likely to believe one. Well, actually, it's a wash, right? I mean, between African American, Hispanic, white, the percentage that believe at least one of those is about the same. Asian Americans is the only group that has a significantly lower level of folks, lower percentage of folks who believe at least one of those is false. So, yay to me, I guess. I don't know. And as far as age, now we like to. There's a lot of ageism in this question. And a lot of people think, oh, if you're older, you believe in this nonsense because they all just listen to Fox News. According to this poll, it's not true at all. The folks who are much more likely to believe this misinformation are younger folks, the 18 to 24, and particularly the 25 to 44. If you're 65 and over, you're much less likely to believe this misinformation. It's the younger folks who believe this. What about education, income, and urbanicity? Well, this looks like urban rural doesn't really make a huge difference. It looks like more rural people are unsure. Income, it looks like those making under 25K are more likely to be unsure, but there's just as many people making over 100,000 who believe at least one of those is true. So there's not much correlation there. Education, you would think, makes a difference, but oh, this is really painful. Look at graduate degree. 26% of graduate degree holders believe at least one piece of misinformation is true. Oh, that's painful. That just, I would love to see that data parsed out a little bit more, because that is just painful. That is just painful. By political party, not as much of a difference as you'd think, but there's definitely a difference. Republicans are much more likely to believe one of these is true. And given the Republican, the right-wing media's role in spreading some of this, that is not unsurprising. Okay, but not as significant. I mean, there's still plenty of Republicans who believe that, no, this is all BS. And Democrats are much more likely to say that none of these are true. So there's definitely a political split, but maybe not to the degree that we think. And there, we can't, pigeonhole all Republicans as, vaccine deniers. There's plenty of Republicans who understand that vaccines are incredibly important public health tools and have been vaccinated. Okay. So again, looking at how much misperception you believe, so the degree of misperception is really, I think the striking thing here is the age. More women are likely to believe that none of these are true, which is good news. Men are more likely to say at least two or more are true, which is interesting. But if you look at conspiracy theorists, they tend to be more men than women. Not quite sure what the correlation there is. But the age, again, we got to rethink this very ageist idea that it's people who are seniors who believe all this misinformation. In fact, they're the best informed about it. They're much more likely to say that none of this is true. It's the 25 to 44-year-olds that are the big proponents of some of these misconceptions. Yeah. And you look at income. Again, same thing with income. 16% of those making over 100,000 believe at least two of those misconceptions are true. 16% of graduate degree holders believe at least two or more of those misconceptions are true, which is really just shocking and just makes my head really, really hurt. And by political party, again, there's definitely a difference, but not as much as you think. There's plenty of Republicans who know that all these misconceptions are completely false, but they're more likely to believe some of these conspiracy theorists. And again, that's given the right-wing media's role in spreading some of this, it's not surprising. All right, I'm going to skip over these. And I'm out of time. And this one is another one that let me go through this really, really quickly. Okay, because I think this is an important one. There's two more I want to go, because there's one that says, there's another survey asking specifically about vaccine mandates and whether Americans are for vaccine mandates, which is really enlightening. But you know what? I'm going to go over the next three of those next week. I apologize I couldn't get to this, but I think it still will be very relevant next week. So there's three more polls I want to go over. What Americans think about people who are not vaccinated, and this is really interesting, their attitude towards the unvaccinated, as well as Americans' attitude towards mandates, whether it's an overall national vaccine mandate, mandates for school children, mandates for college students, and mandates to fly. And then the final one is attitudes among healthcare workers towards vaccination. And that one's also fascinating. But I've covered a lot already today, so I'm going to save those for next time. So the takeaway here is that the unvaccinated are a complex group. We cannot pigeonhole them into this one, the extreme anti-vax group. I sincerely believe that there are folks in that group that will get vaccinated in the coming weeks or months, and that we need to reach out to them, not with stereotypes or with scorn, but with, good information and empathy. And I think we can convince some of these folks to get vaccinated. The worst thing we can do is just, again, pigeonhole everyone who's not vaccinated into this one group. It is a very diverse and complex group. And once we understand that, we can actually reach these folks. Okay. Otherwise, I will sign off here. I hope you all have a good weekend. Please wear those masks because I think that is important to do, especially given the numbers we have right now. Please wear those masks for the folks around you. Otherwise, stay safe. And I will see you next Friday with more news and more information.